member or as part of a union, please let us know. So that being said, we're all here to support our nurses who've been on the front lines, protecting all of us in our community during the pandemic. I know that many of us have been, we've been very supportive. It's not enough to just sort of share these messages over social media, talking about how much we love our frontline workers. So today we're going to learn a little bit more about what our workers have been going through during the pandemic and what we can do to support them in their fight. We've got a lot of common ground with these workers, regardless of whether or not you're in the medical profession or not. The mental health unit in Greenfield has been slated for a very long time for closure. That was delayed, thanks in part to the organizing that we've done in the past, but also a lot of it has been because of delays due to the pandemic. And unfortunately, as they're breaking ground in Holyoke, they're talking about closing down the MHU here in Greenfield, and that's going to have an impact on our community. So we're going to hear more from the experts and those who are on the front lines working in that area about how they believe this is going to affect our community. We're going to have an opportunity to hear from other nurses who work in other areas. We are going to have an opportunity for people to ask questions. So we ask you to hold those until later. You can pop it into the chat, but if we can get through the agenda and allow everyone to speak before we take questions, we'd appreciate that. And that being said, I'm going to pass this on to Lydia.
Thanks, Sheila. And hi, everybody. It's great to see you here. My name is Lydia Wood. I'm the Executive Director for the Western Massachusetts Area Labor Federation. The Federation is a federation of 65 public and private sector unions, and we represent approximately 30,000 union members from across the 4 counties of Western Mass. Our Federation members include everyone from educators and paraprofessionals to food service workers, firefighters, social workers. It's a real pleasure to be here tonight and to see so many new and familiar faces standing in solidarity with the hardworking nurses of Baystate Franklin Medical Center. As a federation, we strongly believe that access to quality, accessible, and affordable healthcare is a basic human right that should be guaranteed to all people, regardless of income, employment, geography, and health status. We also believe that ensuring a fair contract for our nurses is a pivotal part of ensuring that our working class communities can actually access that right. Our members know how vital it is for our nurses to be treated with respect and to have the resources they need to do their job effectively, not just for them and their families, but for our whole community. So just as the adage goes that teachers' working conditions are students' learning condition, so goes it for our nurses. Our nurses' working conditions absolutely help dictate our community health. When nurses' working conditions decline, our whole community suffers, and those most in need are more likely to pay the price. We've watched time and again over the past 2 years as hospital corporations and administrators thank their healthcare heroes for weathering this pandemic and caring for our community, while they simultaneously turn around and continue to cut and privatize services, systematically understaff their hospitals, and increasingly rely on contingent travel nurses rather than offering a fair contract to our community nurses. This is as unacceptable, and as a community, we must stand together and fight back. In Western Mass, our community hospitals are fundamental for ensuring that working class people have access to healthcare. Many in our community remain underinsured, uninsured, oftentimes transportation insecure, and they rely on these community hospitals like Baystate Franklin as their primary source for healthcare. When workers get injured on the job or face an illness, it is also vital that they have access to local quality care that allows them to heal and to recover within support network of their community. The move in healthcare to an increasing reliance on contingent workers is something that we in the labor movement are all too familiar with. In industries from social services to transportation to education, we've seen corporations and major employers fueled by their own greed, privatize and employ an increasingly contingent labor force to amass greater profit. When this happens, we all pay the price. We need our nurses to stay in our community, and that means ensuring that our local nurses have a fair contract with safe staffing, fair wages, and respect on the job. We'll wait until we figure out how to get that guy off. Okay. So thank you all for coming out today to stand in solidarity with our local nurses and community in the fight for a fair contract and also for healthcare justice in our communities. Both of these fights are linked and intrinsically connected. So it's my pleasure to turn it over next to Nicole Roach. She's the Associate Director for the Mass Nurses Association, and she specializes in healthcare resources. So I'll turn it over to her.
Thanks, Lydia. You so well said so much of what I'm about to say. So nice job. And I cannot share the screen. So Joe, that's up to you. That's not it. Do you think you have the right thing?
Sorry, give me 1 second. Sorry about that.
I just sent it to you in an email a minute ago. We should be good at Zoom by now, but
I think this is the document here.
And while
yeah. Did somebody want to say something first?
Oh, I was just pointing out that in the chat box that if folks have questions, they can put those in the chat box and we'll be collecting them. You might have some questions come up through this presentation and we'll answer them later.
Yeah, good point. What I first wanted to do, I guess what I want to do tonight is just spend a few minutes talking about, as the slide says, how and whether Baystate Health is doing its best to recruit, respect, and retain nurses both throughout COVID and into the future. And I want to give you a sense of how Baystate Health is doing financially during the pandemic, and also how that sort of squares or doesn't square with how nurses and patients are doing inside the hospital. And last, I want to look at kind of Baystate's view of the future, their vision of Baystate in the next 5 and 10 and 15 years, and what that tells us about their priorities. So you can, next slide. So first I want to talk about COVID finances during COVID, because there's so much talk publicly about what hospitals are facing during COVID, how they're really on the brink of despair. And it's true that Western Massachusetts hospitals have faced definite financial impacts. But I think, I want to kind of look at what's true and what isn't. So first, it's true that the state required hospitals to cancel non-emergent surgeries and treatments. And the goal of that was to free up beds for COVID patients and also to reduce transmission of COVID from COVID patients to non-COVID patients. And on top of that, the cost of caring for COVID patients has been incredibly high. As any of the nurses here can tell you, they require lots and lots of interventions. So intubation, ventilation, lots and lots of medication. So hospitals did make less in 2020 than they anticipated and that they would have made otherwise. And a good portion of hospitals lost money. So this slide, let's take a look at what actually happened at Baystate. So Baystate Health physician practices lost $58 million. And that's a big number to most of us, or it should be. But physician practices lose money every single year, even in the absence of a pandemic, because their goal is to really funnel cash into the acute care hospital. In addition, in 2020, Baystate Wing and Noble Hospital lost a combined $17 million, and Baystate Franklin lost $1.5 million. But those losses definitely don't tell the full story. Just can flip to the next slide. So in 2020 and 2021, Congress passed multiple pieces of legislation to provide funding to hospitals in the form of grants and zero interest loans. And the goal of that financing was to aid in the high cost of caring for COVID patients and to also minimize the financial losses that everybody knew hospitals would face. And so Baystate Franklin received $27.4 million in grants and loans. Baystate Health received a total of $404 million. And so there's not a lot of outstanding debt. Most of the loans have already been paid back, and the grants were just used by the hospital in, pretty much however they saw fit. Next slide. So Baystate Medical Center in 2020 made a profit of $95.2 million, and Baystate Health made a profit of $44.2 million. So that accounts for the losses in the physician practice and the community hospitals. And if you look at profits statewide, you'll see that Baystate Health was the 6th most profitable healthcare system in the state, but the only Western Mass hospital to kind of make that list. And what's interesting about that is it makes it a real standout. All of the other hospitals were Boston-based, were Eastern Mass, where cost of living is higher, although I'm sure everybody feels like cost of living is quite high here as well, but it's a different economic situation there. And nevertheless, Baystate really is a standout in Western Mass. And despite those huge profits at the end of 2020, Mark Kerouac, who's the CEO of Baystate, said that it was a quote unquote lean and perilous year. And he's talking financially, but you can flip to the next slide. Inside the hospital, I think nurses and patients would probably agree that it was a lean and perilous year. For part of the first year of the pandemic, nurses were working without adequate PPE. They were wearing trash bags. They had inadequate masking. Nurses had asked for safe housing. So in many hospitals in the state during the past 2 years, hospital providers offered their RNs safe housing so they could actually have a place to go after work without risking the lives of their children and families. Baystate refused. Baystate continued its practice of unsafe staffing. That was true before the pandemic and continues today. And plenty of RNs got sick with COVID, got burnt out, or left. Can flip. And yet hospitals continue to blame the lack of nursing staff on a nursing shortage. So let's take a look at whether that shortage is based in reality. You can flip to the next slide. While I drink my water, I'll let you look at the data. So this data represents 2019 to 2020, and it's the number of licensed RNs in Massachusetts in each of those years, with the exception of 2021. And you'll see from 2019 to 2022, the number of nurses in Massachusetts licensed and ready to provide care went up by 24%, which is actually 29,000 nurses. So there are nurses more than available. So what's the nursing shortage really about? So M&A President Katie Murphy says that there's a shortage of nurses willing to work under these conditions. So the conditions are what I just spoke briefly about: unsafe staffing, unsafe conditions in the hospital. And then I have a couple of other quotes from 2 other Massachusetts nurses. One, I truly do not think right now that people can be a bedside nurse for their entire career. It's not physically, emotionally, or spiritually possible. And the next one says it's helplessness and hopelessness all at the same time with no end in sight. And I'm sure Suzanne and Donna and any other nurse who's on this Zoom can share their own experiences and tell you what those quotes really mean in real terms. So this slide, so Baystate Franklin nurses are also among the most underpaid nurses in the state. While maps, I'm sure we've all been looking at COVID maps for the past 2 years, and while the maps in Franklin County have turned deep red over and over and over again with like the high rates of COVID cases and deaths in Franklin County, at the same time, hospital executives were expecting nurses to show up to the hospital in their trash bags and provide care to too many patients and then go home to their children and then return back to the hospital the next day, and over and over and over again, all the while ignoring pleas for more staffing and all the while dramatically underpaying them. And it's just impossible to retain highly educated, highly trained and experienced nurses when you treat them like that. And Mark Kerouac said, he acknowledged that the staffing shortage was, quote, a salary and wage thing. That's definitely not the whole story, but I think it's important. Travel nurses in the graphic that you're looking at, travel nurses are the green columns, and the Baystate Franklin nurses are represented by the blue columns. And what you'll see is that travel RNs who don't live in the communities where they work typically, who don't know the hospital, who don't know the patients, especially in a place like Franklin County where people tend to know each other, including in the hospital, but they're also making dramatically more than the Franklin nurses so the blue lines, this shows nurses who are Baystate Franklin employees at various steps in their career. So even right above number 18, even the most senior nurse at Baystate Franklin is making maybe half of what nurses who are travelers are making. So, and traveler nurses might be making up to $90 an hour, and they might be staying in hospital provided accommodations. And the thing is, they deserve that. Like, they deserve to have a safe housing, and they deserve to be well compensated for incredibly difficult work during an incredibly unparalleled time. But it begs the question why Baystate Health doesn't think that Baystate Franklin nurses who live in these communities also deserve that. You can switch to the next slide. And so, and the truth is, whether or not Baystate thinks Franklin nurses deserve it, they can certainly afford to pay it. So these two numbers represent the 2020 finances, or 2021 finances, but just for the first 9 months. So in the first 9 months of 2021, Baystate Medical Center made $158 million, which is a lot of money for any hospital, even not in a COVID year. Just it's a remarkable number to make in 9 months. Baystate Health system-wide had a profit of $135 million. Again, that accounts for the losses in the medical practices. And so we already know that Baystate is not spending those vast sums on staffing. So I'd like to take a look at what they are spending it on. And here I've included, I'm going to talk about 4 priorities. And they're, Baystate's spending money in lots and lots of different ways, but these 4 I think are really important to examine. 1, executive salaries. 2, new building and renovation projects. 3, closing mental health units in 3 communities. And 4, opening a for-profit mental health facility in Holyoke. So you can switch to the next slide. So priority 1, executive pay. So Baystate's Mark Kerouac, their CEO, is always on the list of the highest paid healthcare executives in the state, as some of these headlines highlight. You can flip to the next slide, where we dig in a little on Mark. So Mark Kerouac, between 2018 and 2020, so that's just 3 years, he made a combined $6.4 million. His pay rose by 28% between 2018 and 2020, when he made $2.45 million during a pandemic. And a portion of this $2.4 million is an $816,000 bonus, again, during a pandemic. That same year, pandemic year 1, 2020, Baystate paid just 15 executives a combined $10.5 million, and $2.3 million of that was in bonuses. So I just wanted to give you kind of a sense of how Baystate values, if not its nurses, its executives. You can flip to the next slide. The second priority I wanted to highlight is building the hospital of the future. So in the latest installment of this multi-year investment, this latest installment is a $208 million project that's building out an existing structure. Baystate's building ORs and labs and expanding and fancifying its lobby, and spending a lot of money on technological innovations and so on and so on. But in none of its public statements on this project has it mentioned staffing once. So it's interesting that they're pointing to all of the expansion without any attention to how they'll care for patients there. You can flip to the next slide. So this section, this priority is more of a slash and burn than a growing, how Baystate is planning a growth. So Baystate announced in 2019 that it was closing 3 community hospital mental health units: Noble Hospital in Westfield with 20 beds, Wing Hospital in Palmer with 28 beds, Franklin Medical Center in Greenfield, of course, 22 beds. And what's so important about these beds is that because they're in a hospital, they provide a full spectrum of care. So patients are cared for by registered nurses and mental health professionals and doctors, the whole cohort of professionals who you really need to take care of you. But these facilities also, these units also treat patients that other facilities might not. For example, the Baystate Franklin MHU and the other 2 as well treat patients with comorbidities. So a lot of patients have a mental health disorder, but also have a substance use disorder or diabetes or a chronic illness. And in Franklin County, chronic illnesses, several of them tend to occur at a much higher rate than in other parts of the state. These units treat patients who need treatment on a cyclical basis. They're sort of, folks that come in and go out and then come back when they need treatment again. And they also treat patients who have challenging behaviors or who don't have insurance. And most importantly, I think, or one of the most important things about them is that they treat patients in their communities where they're close to their support systems. You can flip to the next slide. So nevertheless, Baystate says that the benefits of closing those facilities are outweigh the losses. And I think what they mean is the financial benefits, and those are to Baystate, not to the community. And so this is the final section I want to talk about, which is Baystate is opening a $72 million for-profit facility with a Kentucky-based company in Holyoke. So they're closing their 3 mental health units and opening this new facility. And they claim that because when this facility is built, it will have additional beds, that somehow that's a benefit. But I think you can see that it really amounts to many more losses than a benefit, despite the fact that we could all agree that we do need more mental health beds in Western Massachusetts. So the new facility will not require, a few things I think are missing on here. Okay, the new facility will, that's not, yeah, I think we've got a funny little thing happening with this, yeah, it's all right. Just ignore the last page. So the new facility won't guarantee that it will treat people who don't have health insurance or who are on Medicare or Medicaid. It will be inaccessible by public transportation, very far from the most rural communities, especially around Franklin County and near in and around Ware. Their patients won't have access to their support systems, and there's no acute medical care. So again, back to the patients, the majority of patients who have mental health disorders and also have comorbidities like substance use disorder or chronic illness, they won't be able to receive that care in the Holyoke facility. And so then if they do need that care, they're being bounced out of a place where they are supposed to be getting mental health treatment to another place to meet their other healthcare needs. And so Baystate's priorities are really, I think if you take what we've looked at tonight, Baystate's priorities are really all about technology and innovation and growth, and all of those things really are important in healthcare. But I would say the most important components of healthcare are the people, the patients who need care, and the caregivers, the healthcare workers who provide it. And Baystate has really ignored both of those groups. They've ignored calls for safe staffing. They've ignored patients and community members asking to maintain their mental health services. And when a hospital fails to center the voices and needs and experiences of patients and healthcare workers, you have to ask what their real priorities are. And there was a beautiful slide to represent that, but it's not here now. So you just have to go with me. And I'm going to leave it at that and turn it back over to Lydia or Sheila or somebody.
Hi, thank you, Nicole. I think I'm next. So I think that was a really powerful overview of what's happening kind of at that eagle's eye, view. And next we're going to listen. We've got a few nurses who have day-to-day experiences that they want to share with the community, just so that people understand what they're dealing with when they're actually in their workplaces and how this is affecting both their work and also their ability to respond to their patients. And who did we have up first? Was it Donna? I believe is first.
Hi, thank you, Madam President. First of all, I want to thank all of you for being here tonight. I want to thank you for all the work that you do, each one of you in your own way. And Sheila, thank you so much for being the host tonight. Nicole, that was really, really a great and powerful presentation, really surmising how Baystate and all the other hospitals that operate like Baystate, how they behave. And so I want to just tell you who I am. That might be helpful. I know a lot of you, but there might be a few people out there that I don't know. I am Donna Stern. I'm a psych nurse. I work on the mental health unit and have been working on the mental health unit for almost 17 years. I'm also the senior co-chair of the bargaining unit and have been in that capacity for a while now. And so two things that I wanted to talk about tonight is I just wanted to briefly talk about the contract negotiations, because we are currently in contract negotiations. And there were a couple of things I wanted to add to Nicole's remarks regarding this new venture that Baystate's participating, that they're doing with Kindred. That is the company that they're going to be building this new shiny new building with. So the first thing is, many of you who I'm looking out, you know what negotiations have been like with Baystate. This is my fourth contract negotiation. And so far, negotiations have been respectful, which has actually been, has been a different tone than the previous contract negotiations. As many of you know, that those fights were long and they were hard and they were really, really difficult fights. And now we're having a different kind of discussion with Baystate, but just because they're respectful doesn't mean that we're moving in the complete direction that we want to move in. And so what the biggest problem is recruitment and retention of nurses. How do we keep our nurses local? And how do we make that possible? And right now, as Nicole spoke to, is that Franklin nurses are well below what they should be making for the work we do. I mean, we're like any other nurse in the state of Massachusetts, working our tails off in some pretty dangerous situations, and have only become more dangerous because of COVID. And Baystate is paying literally travelers $5,000 a week, and they offered us a 1.25% raise increase after everything that we have done and how we have stuck it out and have been loyal and committed to our community and our patients during a pandemic. That was their way of thanking us, a 1.25%. That was just in the first year, and nothing better after that. So it's a slap in the face. And by no means am I saying every nurse deserves to make a good wage. Every healthcare worker, every essential worker deserves to make a good wage. But we have been telling them and sounding the alarm bells 4 months, actually years. If you want to retain and recruit, you must support your nurses better. And wages is just the start, as you will hear from other nurses who will talk about their experiences of what it's been like working in the hospital in a pandemic and what that's been like. Because I got to tell you, anyone who is still working in that hospital after what we've been through, is built of some pretty tough stuff. And I mean no disrespect for anybody who has had to leave, because it's been brutal. The other thing I want to talk about is that, and I be glad to answer questions because I don't want to take up too much more time, but Baystate is going to tell you, they're going to keep pushing the idea that there's a net gain of beds with this new venture in Springfield. And what I need to tell you, in Holyoke, what I need to tell you is that we're losing 70 adult beds by closing those 3 community hospitals. And we're not going to get a net gain. What will be an improvement, but again, it depends on your health insurance, is that there will be more geriatric beds and pediatric psychiatric beds. But that's still not going to solve the problem of the massive amounts of psychiatric patients boarding in our emergency room. Baystate's going to tell you that this new venture is going to solve all the problems of the boarding in emergency rooms in Western Massachusetts. It's not going to happen. This is not going to solve the problem. And not only that, it's going to make the problem worse in Franklin County. Franklin County is the poorest county in Massachusetts. And the patients that end up on our unit are patients that nobody else wants, because they don't have the right health insurance. And not only that, but they're really, really chronically sick and oftentimes need access to the medical units. So it is just a shock. It's shocking to me that Department of Mental Health gave the green light on this, because people are going to suffer in Franklin County. They already are while we're open, but this is going to make it even worse. I'm going to hand it over to Suzanne, who's going to speak next.
Thanks, Donna. So my name is Suzanne Love, and I, along with Donna, am one of the co-chairs of our bargaining unit. Thanks to everybody who's joined us tonight. We have 93 participants. This is great. So I'm one of the staff nurses in the emergency department. And it's been a really roller coaster couple of years, I have to say. We started off with not enough PPE. And there was I remember this one really scary moment when the nursing supervisor came down at around 7:30 at night with a box with 10 gowns in it, 10 plastic gowns, and said, "This is what we have until tomorrow morning supply truck comes from Springfield or from Holyoke, wherever they come from." That was really scary. We had COVID patients in the ER. We had COVID patients upstairs. And this is the Toyota model of just-in-time supply chain. They had just enough. And media science said for years, there's going to be another pandemic. They said for years, you need to have enough staffing. We sounded the alarm about staffing specifically. We went on strike about staffing for our last contract. And here we are. We didn't have enough supplies then. We didn't have enough, nurses. People have been leaving. People are exhausted. It's been pretty challenging. And now we've talked about traveling a bit. We are literally swapping nurses. Some nurses leave Franklin to go work at UMass Medical Center because it's far enough away to get a travel assignment. In the ER right now, we have a staff of about 32 to 35 nurses regularly. We are going to have up to 11 travelers by September. And some of them came from UMass Medical Center. So we're swapping nurses, but these nurses are getting, as we've already said, a lot of money. And, 2 weeks ago, an ambulance came down the hallway, a stretcher came down the hallway rather, and I'm standing in the doorway of a room with my back to the door. And the patient said, as he rolled by, "Oh, there's Suzanne." And this is someone who I know really well. This is someone with 2 very complicated medical conditions and a psychiatric condition, which is a really hard combination to be able to maintain your own physical health when you have a psychiatric condition as well. This is a person who, when we hear the ambulance box go off, telling us they're bringing someone in, we all say, oh, here comes this person. And we get ready. We know this person. The other night, a regular psych person came in who really struggles and has a lot of anger issues. And we have all learned well how to take care of this person in the emergency setting. And a traveler had this person and made things worse because hadn't learned how to work around this person's special requirements with his mental health condition, that we've all kind of figured out how to help this person best. And I'm not saying the travel nurses aren't excellent, because they are amazing nurses. I have been working with some really incredible nurses from all over the country since we've been hiring travelers. But you also really benefit when you know your population, and your population benefits when it knows the hospital, it knows the staff. And that's kind of missing with this crazy yo-yo of hiring all these travelers. So, in the chat here, my coworker, Wendy Bardwell, a fellow ER staff nurse for a long time. Wendy's been a benefit to our nursing community for more than 20 years in our hospital. She's a paramedic before that. And she made a comment that there's times when we get no breaks. I work a 12-hour shift. And there's times when we are so busy, I don't get a meal break. Luckily, the bathroom's next to the break room. We'll run in and grab a spoonful of peanut butter, literally. As long as there's one certain patient who has really bad peanut allergies isn't there, and I know her. So I know if she's coming in, I can't take care of her if I've had my spoonful of peanut butter during that day, because I know this person. So we need our staffing to stay. We're going to have that by a fair wage increase without a lot of shenanigans from management to get a fair wage increase. We'll have that by having the right equipment to take care of our patients. Baystate can afford it. There's now plenty of masks on the market. There's plenty of gowns on the market. And there's plenty of nurses on the market who want to work at Franklin. I have a coworker who's been a nurse for about 4 years. He shared yesterday at our negotiations that he was born at Franklin. His kids were born at Franklin. Terry, an OB nurse of 30 years, helped birth his children. She inspired him to go to nursing school. And his whole plan was to go to nursing school and work at Franklin Medical Center, which is 10 minutes from his house. So keeping it local really makes a concrete difference in our patients' lives and in the nurses' lives. I've been there since 2008. This is my hospital. I'm not going anywhere. Donna mentioned those nurses who have stuck it out and stayed. I'm loyal, and I'm comfortable working in an environment that I really know well. I know where all the stuff is kept. I know my coworkers. I know the doctors. I know how to approach them, how to work with them. We work really hand in hand in the ER. I can go to doctors and say, this person's got nausea. I think he needs this medicine. Hey, we tried it. This medicine doesn't work. I think he needs this medicine. The doctors will agree, disagree, but we have a respectful communication that makes the difference of working together for a really long time and knowing each other really well. So I hope that we can keep that here in our community hospital. Thank you for being here, everybody.
I'm sorry, I had to find the unmute button. And just a plug for Suzanne and her commitment to the community. The last time I had to walk into the emergency room, I had brought my son in there after he broke his finger. And as a mother who's panicking in the middle of the night, bringing her kid into the ER, it was so nice to see a friendly face and to see someone I recognized. And especially during a pandemic when we weren't seeing a lot of folks out in person. And, that's really comforting. And I know we can't always expect that from an emergency room. And, a 14-year-old breaking his finger is one thing, but I think some of these more at-risk patients, that probably makes a very big difference. I know that it did for me. But I will get off my soapbox. Next, we have Marissa Potter, who wants to share some stories with us.
Hi, I'm Marissa Potter. I'm a labor, delivery, and postpartum nurse at the birthplace at Franklin Medical. I've been at the unit for more than 5 years. I live in Shelburne Falls. I had both of my children at Baystate Franklin, and there's probably a dozen of my coworkers from OB on the call tonight. So I just wanted to talk about what it's been like up there. And really echo everything that everyone else has already commented on in terms of staffing. So labor and delivery is really intimate kind of nursing. So that means that when I take care of a patient in labor, having a baby, I have just that patient. So that means if that person has COVID, that I put on full head to toe PPE, multiple layers. It's very hot. It's very hard to hear. And I might stay in that room for 8 to 12 hours or more, right? And so, and that labor and delivery might go seamlessly. It might get complicated, but either way, I'm in full head to toe PPE for the duration. Pregnant people are at much higher risk of complications from COVID, as we know. We've certainly seen our share of that. So when I started in labor and delivery, that was a really coveted position. It was a really difficult position for a new grad nurse to get. Some of our nurses had been there for 30 plus years, and it was almost impossible to find yourself a job there. In recent years, we've had, or say in the last 2 years from the pandemic, we've had a difficult time filling positions because people are looking for more comfortable, safer, higher paying wages than we're getting here in Franklin County. And that is, it's heartbreaking because the people who do this work care so deeply. I'm sure that we have helped you have your babies. As we talked about Terry before. So I wanted to talk specifically about what's happening on night shift at on our unit. So we staff somewhere between 30 and 40 nurses on our unit, and they're roughly split between the 3 shifts, right? So I'm talking about nurses who are coming in at 11 o'clock at night and working through till morning, right? So that's the least resourced people, the time that the hospital has the least resources available. This is often where new grads start. So Franklin management, Baystate management has talked a lot about the importance of recruiting new nurses, and they're offering huge bonuses, $13,500 bonuses to hire on a new nurse to work with us. The thing about nursing though, in a specialty like that, is that it takes, they say, 12 weeks to orient a new nurse. That means you need an experienced nurse to hold your hand, watch over you, teach you the ropes, make sure you understand what you're doing, so that you can be safe on your own. But 12 weeks is really just the start, right? We get paid our whatever, $1.50 an hour to orient you for 12 weeks. And then it might take 2 more years before you're really safe and independent. Now, as experienced nurses, we're orienting new nurses at like that, mentoring new nurses like that out of the goodness of our hearts so that our patients are safe and so that we are raising up and mentoring safe new nurses to be our colleagues, hopefully for the duration. Now, what we've seen in the last 2 years is that nurses that are close to retirement are retiring because working conditions are hard, and that is difficult to do at the end of your career. We're also seeing younger nurses mid-career who are taking that $7,000 a week contract to go and do what they need to do for their family. We have 2, now 3 travelers on my unit who are making $7,000 a week. That my salary is minuscule compared to that. So for the amount of effort that Baystate has put into filling holes and recruiting new nurses, they could be focused on retaining the experienced work staff that they have already. And those are people who are committed to our communities, people like me who've had our babies there and who would like to work my career at the bedside. So I just want to echo what was said before around that this is not a nursing shortage issue. This is a shortage of people who are willing to continue to work in these conditions. The last thing I want to say is that I believe really strongly that when we negotiate on behalf of nurses, that a rising tide lifts all ships. And there are many, many ununionized workers at the hospital who clean rooms, who deliver food trays, who work in the lab, who sit with people one-on-one when they're really having a difficult time. And I believe that when we raise working conditions for one group of hospital workers, that we raise working conditions for everyone. Thanks.
Thank you, Marissa. Next, we have a community member. I'd like to introduce Allie Wickslim.
Hi, everybody, and thank you for having me on this call. As Sheila mentioned, I am not a nurse. My intense gratitude goes out to all of you for what you're doing, and I'm here to talk about that a little bit. And also just to talk about the importance of a local community hospital to my family, and I think I share this experience with a lot of families. I'm going to start with a couple of stories about why Baystate Franklin matters to us, why I'm here tonight to talk about how much your work matters to my family. 17 years ago, my first child was born at Baystate. And when I think back to that experience, I was there for a few days because I ended up having a C-section, and I was just so aware that I was in such good hands. I was so aware the entire time there that the care I was getting was exactly what I needed, what my baby needed, and that we were going to be okay. And it was the nurses that made that happen, right? Like, it was a nurse who picked me up off the floor when I passed out the first time I stood up after surgery. And it was a nurse that figured out how to get my baby eating when he couldn't figure it out, and neither could I, because, like, what did I know? And we lived up the road from the hospital. In fact, we were on Hastings Street in Greenfield when my son was born. We had joked that if we had to, we would sled to the hospital because he was born in January. And we didn't have to sled to the hospital, but it meant the world that my partner could go home and take a shower and come back and hold the baby so I could sleep and not have hours of travel in between. So my connection with Baystate Franklin really is very closely tied to my connection with becoming a mom. And those early days, they're so vulnerable and so hard. And it extended beyond that with the breastfeeding support group that we came to every week, and the nurses there that were such a big part of that transition. To the point that on my son's first birthday, we popped him in the stroller and walked to Baystate and dropped off cookies for the nurses because it felt like they had been such a huge part of the first year of his life. 6 years later, his sister was born. And at the time we lived in Amherst, and we toured the birthplaces that were closer to us and ended up deciding to go back to Baystate Franklin because of the baby-friendly approach and because of our positive association with being there. And then I should have mentioned between those two things, the first baby that was born at Franklin was back there at age 2 with an anaphylactic reaction to peanuts. He had an allergic reaction as a toddler. And what we realized in that time was really how important proximity to reliable, safe healthcare was going to be for our family. For people who are not familiar with anaphylaxis, he could have a matter of minutes before his throat could close if he is exposed to even a tiny trace protein of peanut or tree nut. So we don't have time to go to Springfield if he's reacting. And we frankly don't have time to show up at a hospital where somebody doesn't know where everything is because they just got there that night and they haven't had the training and the mentorship that they needed. And they haven't been made aware of where things are or what the protocols are for somebody who's going into anaphylaxis. I think there are great nurses all over the country, as people have mentioned. My son's life depends on the nurse who receives him knowing exactly where to find the equipment she needs to save his life within minutes. And so it means the world to me to know that a few miles from our house, there's a hospital with an emergency room with, people who are ready to take care of him if he needs care. And, frankly, the trip to another community could be too far for him. So that's a piece of why we value Franklin so much. When my daughter was born, I credit Baystate Franklin with the fact that I got to have a VBAC with her, which was really important to me. The nursing staff was incredibly patient with us and gave me the time to have the birth that I wanted. I really believe that in most of the hospitals in our area, I would have ended up with a second C-section. And they took incredible care for me when I had some complications after her birth. So I just want to go kind of fast forward because I'm done having kids, but I'm not done with healthcare. And I go to Baystate now for a lot of routine care. I laugh my way through mammograms, which are relatively unpleasant because the people giving them there are so funny and they make it kind of an experience I don't dread, right? Last year during COVID, I had a health scare that required a CAT scan, which, is scary anyway. And then to come in during a pandemic is especially scary. And the staff there were so incredible. But the most important part of that story for me was what I learned about their experience, which was that I had a cold when I went in, and I'd had a PCR and I knew it wasn't COVID, but I called because I wanted to make sure they were okay with treating someone who was still sniffling. I didn't want to scare them. And I said, I'm fine with, rescheduling if I need to. And I couldn't believe how overwhelmingly grateful they were just for that phone call. I said, I have a negative PCR. It's not COVID. I don't need to come in. And they were it was just so clear what the wear and tear of the last couple of years have been like for them, because they were so grateful and so thankful and kind of couldn't believe that I'd gone out of my way to call. And I couldn't believe that that was a unique experience for them. I couldn't believe that the whole community wasn't taking care of them in that way. And it got me wondering, because I have always felt like I'm in good hands at Baystate Franklin, and I've always felt like my kids are in good hands there. And for the first time, I really started to wonder if the workers there were in good hands in this community. Like, are we taking care of the people who are taking care of our kids or not? And I started to worry about that. And then I'm not going to tell you, I promise, like every story of our time at Baystate, but the other important thing that happened during COVID was my daughter hurt her foot and we ended up at the ER. And I had steadily avoided the ER during COVID for obvious reasons, right? Like, I did not want to overwhelm the staff. I did not want to expose myself or my kids to what COVID might be there. So here we are 2 weeks shy of my daughter being eligible for vaccination, and she hurts her foot and can't walk. And we're at the ER. We get there and there's a woman coughing and screaming in the waiting room about how she's not going to get vaccinated and she's not going to wear a mask. And immediately, I don't want to be in that room with my daughter. And I'm trying to negotiate to wait outside in front of the building. And I don't fault the staff for this at all, but they were unable to meet that request. Why? Because they were so understaffed that they could not afford someone to come out and get us when it was my daughter's turn. They were so overwhelmed and had so little time that they could not make a phone call to tell me we were out there. So it really drove home to me what these people were up against. And my heart just went out to a community of healthcare professionals who only want to help and were in a position where they couldn't even give a mother the opportunity to get her child out of a dangerous waiting room. When we finally got seen, we ended up in a stretcher in a hallway. It took a really long time. We left with equipment like a brace for my daughter that didn't fit her foot and crutches and instructions to go somewhere else the next day. And again, I left with nothing but gratitude for the people working there, but also with kind of a newfound sense of the toll that this pandemic has taken, because my experience at Baystate up until that point did not reflect what happened that night. And it renewed my commitment to talk about, what we as a community need to do better. And it made me remember a time early on in the pandemic where I was part of a car caravan that drove around the hospital with signs. I think, Rose, you might have helped organize it. And we were, honking our horns and waving our signs, and people with all their PPE were coming to the windows. And I think everybody was crying. And I just remember going home after that and thinking, I went from the safety of my car to the safety of my home, and I left them there. And I felt such a sense of responsibility to be a better advocate. And I think about what must have gone on in those people's lives between that car caravan day and our day at the ER just last fall. And it makes me realize the value that we put on the healthcare staff at Franklin Medical is not reflected in your treatment and in what these negotiations are looking like. So I just want to be really clear that Baystate Franklin serves an absolutely crucial role in this community. There are a lot of people here who are not going to be able, either through resources, through transportation issues, or just through time, like my son, to wait to get to another community for healthcare. We need quality healthcare close enough to home that we can get it, we can access it. And we need the people in that building to have the support that they need to do the job the way that they know how to do, and the reason that they came to this field to do it, right? I think it's really important to just acknowledge as a community member that the frontline staff at the hospital are the people most likely to deliver our babies. They're the people most likely to take us in at the ER. They're the people most likely to be running our diagnostic tests, to be doing those x-rays. They're the people who are going to communicate with our children when they're scared or sad or injured. The frontline workers who are negotiating for this contract are the people who are ultimately going to be the face of whatever experience we have in these spaces. And we need to have benefits and pay that reflect that and honor that. And finally, I just want to say, some of this information just came to me as I prepared to talk to you all tonight. As a member of this community, I'm outraged to hear about the corporate executive raises that have been going on during this time. I have also heard the news in the stories about how the hospitals are taking a financial hit, et cetera. And I imagined something like this was going on, but I had no idea the extent of it. That presentation earlier really drove that home. So all I can think about is the fact that those people with those giant inflated salaries and those huge raises are not going to save my kid. They're not going to help a woman deliver a baby next week or tonight or tomorrow. They're not going to even see a patient. And they're taking this enormous amount of funding. And that renews my commitment to speaking out and in support and solidarity of the frontline workers at Franklin Medical, because all I can think about is, what would happen if we just decided that there are no more raises for people in those kinds of positions, people who have no contact with patients, until the people who have been risking too much for too long with too little have what they need. I'm in full support of your contract negotiations. I want to see people paid fairly. I want to see people able to stay in the community where they work, because our community needs this hospital, and it needs the people working in it to be working for a system that values people over profit. And that's about all I have to say. I just want to thank you all again for what you've done, because hearing what you're going through and the uphill battle, and the fact that on top of all of the patient care, you also have to be thinking about negotiating for fair wages. It's infuriating, and it's not okay. And I think there are a lot of people in the community who would stand with me in solidarity with you. So ask us what you need, we'll show up.
Thank you, Allie. And then thank you also to Donna, Suzanne, and Marissa for telling us your stories. Now we have a Q&A from the community. If you have a question, please type it into the chat box. I know that Joe's been collecting questions up until now.
And Sheila, do you want to just go ahead and answer that, or ask that first question, and then we'll start pulling from the community?
Sure. Yeah, I thought I was going to go last, but I did want to know. So especially during the early months of the pandemic, it was really hard being on the outside, knowing what was happening on the inside of the hospital. So what was that like? And I want to know, what kind of challenges have you faced? What challenges? I'm sorry, what challenges that you faced, what you've touched upon already, like anything new, and what was it like then compared to what it's like now?
I think for this section, we're just wanting to give an opportunity for any other nurses that are on to share some of their stories.
Shari Mersik, do you want to say something? Are you on still?
Hello, yes, I'm still on. I'm gonna put my video back on. Okay. Well, what it was like at first, it was very scary because we didn't really know what we were dealing with. We had not enough PPE, and we didn't have the information we needed because this was a new disease. Families could not come into the hospital to be with their loved ones, so the nurses took that role as well as the role of nurse, and sitting with patients who were dying, holding their hands, doing what we could, being with them at their last moments. It was heart-wrenching. It was absolutely heart-wrenching, and we did feel like their family, and we nursed as best we could in the situation we had. And we loved all of these patients, just like we were their family, and conveyed to family what was going on. I think those early days were the hardest, especially when you had multiple people dying during your shift. So trying to be professional, help people as best you could, not get caught up in emotion. It's nothing I've ever experienced before. And now we do have more information, we have more treatments, we have more PPE, thank God. But it is grueling, it's exhausting, it's emotional, it's taxing mentally, physically. But we do what we do because we love our patients, and we do it the best we can. And I have to say, I love my job at Franklin. I love my coworkers. I love the patients. It's a great place to work. I just wish I felt valued. And honestly, why wouldn't we leave to go be travel nurses and make 4 or 5 times the money we make now? Think about what that could do for our families. We really need to pay Franklin nurses so we can attract more nurses to the community hospital and keep the nurses that are so valuable that we have there. Thank you.
Thanks, Shari. One of the other, I'm Rose Bookbinder, and I work with the Mass Nurses Association and get the honor to work with the nurses at Baystate Franklin, along with Rudy. And our next question was from a community member about what you all can do. So, I mean, the first thing is you've showed up here, which is incredible, and we've stayed at around 100 people, which is just really a wonderful turnout. And yesterday, we had a bargaining session, and I feel like we already felt the results of like knowing that this community forum was coming, and Baystate knew. And so I, just thank you for being here and showing them that the community does have a concern. Maybe after this meeting, if you go on to if you're on Facebook or social media, you could go on and tag Baystate and say, wow, like I heard from nurses, what's going on, and we urge you to, settle this contract quickly, and tag them on their Facebook page or their Twitter or Instagram. I'm not sure if they have Instagram. But that, they don't want bad press. So knowing that you all listened and turned out tonight and heard these powerful stories is part of escalating and showing the hospital that the community's behind them. We put in the chat box the community petition. If you could share that with 1 to 5 other friends and ask them to sign, that will, get us up to 5. That could get us up to 500 new petition signers tonight. If you get 5 friends or family to sign, that's huge. Even one person would mean we're at 200 tonight. And if you then can make a commitment tonight to turn out to the next forum or to turn out to the next picket that we might have, and again, maybe bring one person with you, share the story with one other person so they feel invested in wanting to turn out too. We can each be our own little organizers and make sure that more people are with us the next time that we need you in this contract fight. And I don't know if there are any other nurses that might want to say specific things that you need in seeing that you have support. Donna?
Yeah, thank you, Rose. That was fantastic. I think the other thing that would be really important is a couple things. Writing letters to the editor, so we get more press. Just like what Rose said, their biggest fear is any kind of bad press. So flooding the editor with letters would be really powerful. That's something you can do immediately. The other thing I want to let you know, logistically, we still haven't figured it out yet, because our negotiations have always been open, not only to our members, but to the community. And so Rudy said to me at this point, she's trying to secure a larger space at the church where we negotiate. And so what would be really helpful is if you could give the information, if you haven't already, to Rose or Joe, or Rudy, so that we know how to get a hold of you. So when we can open up negotiations to larger groups of people, we would love to have you there. It's very, very powerful when management sees the nurses alongside the community members. It sends a very powerful, powerful message. And the community has always been an integral part of our campaigns, because like you already know, this is your hospital, right? This is your hospital, and you know, our conditions are your conditions. I mean, that's the truth. So we're in this together. We very much think about this as a together project. But those are sort of the immediate things that I hope that answers the question.
Do you want to say goodnight now?
Oh, yeah.
No
Okay.
more questions.
At this point, we're going to stop on the questions. But if you have other questions that we can answer for you outside of this forum, we'll be glad to do it. But I wanted to say in closing tonight, first of all, I want to say thank you, thank you, thank you. I wasn't expecting such an amazing turnout, so I can't thank you enough for that. The other thing I wanted to say is I want to give a special shout out to my fellow nurses. I get very emotional when we talk about this because they're amazing. They're absolutely rock stars, my coworkers. And I can't thank you enough for continuing to go to work every day and give everything you have to our patients, because you're my hero. You're my heroes. I didn't know, Suzanne, if you wanted to say a couple of words in closing.
Just to echo you, Donna, thank you so much for coming. It's really heartening and wonderful to see how many people from the community, how many of our coworkers we have here. I see we have a provider or two here from the hospital. That is great. And then, of course, we have our area representatives to elected office. And we always appreciate the help and the assistance and the support from those elected officials who come to our negotiations, who reach out to us directly. We've been able to speak with a couple of them this past week as a group presentation from several of the nurses, and we always really appreciate that support. So thank you from all of the areas of the community who have come out to join us tonight, and we will keep you posted. Of course, also, I'd be remiss not to say Katie Murphy. Thank you.
Katie.
President Deborah.
Katie.
Thank you all.
Katie's amazing. She is our captain, and she does remarkable work. The other thing that you have to know about anybody who's on the board of directors for the M&A or as the president, they are a working bedside nurse. So Katie is a working bedside ICU nurse and has been working her tail off, not only as our president, but taking care of COVID patients. So shout out to you, Katie.
It's all to you. It's all to you. Thank you for everything. And this is a tremendous turnout in support of the terrific Baystate Franklin nurses and their hospital that they make.
So I
Am
think
able
it's
to
done
just add
now.
one thing?
Oh, sorry. Who is that?
It's Ariel.
Oh,
Sorry,
it's
I don't
Ariel.
have my-
Yes, yeah.
Hi, I don't have my video on because it all just ground to a halt when I tried to have it on. I just want to add, Rose was saying yesterday that it might be important just to explain kind of what nurses' job and education actually is, because maybe it's not as widely known among the community. There's a lot of like public image of nurses as like, we're making your bed, we're bringing your water, we're giving you your medicine. But there are years and years of education that go into even beginning to work as a nurse, let alone all the whatever you're going to learn in your specialty. We have to know all of the biology. We have to watch your labs, understand what your labs mean, what interventions you're going to need. We're watching your vital signs. We're watching just what you look like. And We're advocating to the doctor for what you need. We're reassessing you. And we have to have all that know-how too, to say to the doctor, you know, I need this or I need that. Because they have so many more patients. They can't possibly have their eyes on patients all the time. And I also want to emphasize there's really no substitute for knowing your patients. We have patients who come in and if we didn't know them, we would miss things. To know someone well enough to just look at them and say, you look different or something else is off, and say, we need to do this test or that test. There's all that technical knowledge and a ton of technical skills, communication skills that goes into our job that a lot of people, like maybe people don't see because it's behind the scenes. So I just wanted to put it out there that there's like a huge, vast wealth of other stuff going on that you may not see as a patient that's still all part of our job.
Thanks, Ariel.
I'm going to just to piggyback on Ariel, this is Suzanne Love again. I remember learning in nursing school that we nurses are ultimately responsible for a medication error. Even if the doctor orders the wrong drug, we are responsible for knowing it's the wrong drug and for making sure the patient doesn't get it, because the drug goes from our hand into the patient's body. I learned that in nursing school, and that was scary. And so it's, you know, it's true. We are the watchdogs. There's more of us, as Ariel said, there's more of us than there are of them. At the peak of staffing, there's 3 providers and there's 7 or 8 nurses in our department. There's more of us watching the patients, and we carry a lot of responsibility for your care, and we are honored to do it. And honestly, I think my job is a lot of fun. I really enjoy my job. But Ariel, thank you for those comments.
Yeah, the other thing is we have to know everything that's going on with all of our patients. So the more patients that we may have at one time, you know, the more things we're trying to hold on to, and it's easier for things to slip through the cracks. And it's all high stakes in what we do. So it's really important that we can be staffed safely to keep our patients safe.
The other thing I wanted to say, this is Donna, quickly. I did not know when I became a nurse that I was also going to have to become a computer expert with the complicated electronic medical record. But half the time IT is not available. And as charge nurse, a lot of the time now I fix computers on top of everything else that I do. So I just wanted to put that out there, that when we say it's complicated on multiple levels, the knowledge that we have to have. I wanted to hand it back to Madam President Sheila Gilmore if she wanted to say anything in closing.
Oh, I just want to thank you for your dedication to our community. I know that this is probably the worst time in history, well, maybe not history, but modern history, to be a nurse. And I know that, you know, my heart always goes out to you. I remember before the pandemic, I remember feeling like you were short-staffed and being very concerned about your well-being and how your well-being was going to affect those of us in our community. And now, I mean, that's all right out the window. We've got, you know, we've got our new normal. And I'm really upset that you're still fighting this fight. I hope that there's something that I can do and that, you know, my fellow community members are able to do. I know we've talked about signing this petition and sort of keeping an ear to the ground for future actions that, you know, may come up. Hopefully there's no need for them, but, you know, if we can all stay in touch, I would really appreciate, you know, any opportunity to help those who have worked so hard to help all of us during this.
Thank you, everybody. It was a pleasure and an honor to be here with you all tonight. Be safe, be well.